If a soft tissue sarcoma has been diagnosed, surgery is usually the next step in the treatment plan. Soft tissue sarcomas are uncommon cancers that begin in muscle, fat, tendons, nerves, or blood vessels. The main goal of surgery is to remove the tumor along with a thin margin of healthy tissue around it. Because sarcomas have over 50 subtypes, guidelines recommend care at a specialized center with a multidisciplinary team. For arm or leg tumors, limb-sparing surgery is now the standard approach, preserving muscles, nerves, and blood vessels wherever possible. Retroperitoneal sarcomas sit behind the abdomen and may require removing nearby organs together with the tumor. When surgery leaves a large gap, reconstruction with skin grafts, muscle flaps, or vessel grafts is done in the same operation. Radiation is often combined with surgery, given either before or after to lower the chance of local recurrence. Under general anesthesia, the surgeon removes the tumor together with the biopsy track, keeping its outer covering intact. Hospital stay is usually 3 to 7 days for limb surgery and longer for abdominal or reconstructive operations. Physiotherapy begins within the first days, and strength and movement continue to improve over weeks and months. Possible complications include wound healing problems, infection, nerve injury, and some loss of function in the treated area. Follow-up imaging every few months for the first few years helps catch any recurrence early when it is most treatable. Did you know you can get this treatment abroad at the same quality you'd get in the US or Europe for a fraction of the cost?
Ginger Healthcare is one of the world's most trusted medical travel companies. It helps patients to find safe and affordable care in India, Thailand, Turkey, Singapore, Dubai, Malaysia, and more. Visit ginger.healthcare or check the description for details.